Dental implants have been in the market for 30 or 35 years. So in the market, when they first started, there were a handful of companies that they were doing them. Now you find that there are too many companies that they're starting to be in the business, and some of them actually they clone each other. The actual difference in the shape and sometimes the surfaces of the implants is the things that we see in the market. But in reality, there's also differences in techniques of putting implants. Some of the techniques involve doing it without raising a flap, like we call it punch techniques, or some of them with raising flap, which I favor, because when you raise a flap, you see what the bone is. Because no matter what, with all respect to our clinical judgment and x-rays, you have to see what's going on. So I believe that when you raise a flap, you see exactly what you're doing. So a lot of companies, they come up with techniques about punch or about doing guided implant surgeries, which is great. It's very promising, and I think that's the way. But I still believe that you have to know how to raise a flap and know exactly how the bone is, because sometimes you need to do that as well. So this is very important. Products, as I said, are different. Every company come up with a different kind of surface or a different kind of abutment to make things easier and make things last longer and has a longer and longevity. But in reality, most of the implant works if things are well prepared, if it's in the hand of the good dentist who assesses things, who knows exactly what he's doing. And that's why the experience is important. The implant technology is always changing, so there's always new things coming to the market. Always there's a new techniques that can make the procedure easier and more affordable as well. And crowns in general that we put in with the implants are either screwed on or cemented into the implants. And with that, it depends on the case. I prefer sometimes screw type of implants because it can be retrievable. Having said that, it depends on where it is located and the condition of that implants. The other thing with implants is that implants come in different sizes depending on the limitation of the bone width and height in there. So they come in different diameters, and so we have, for example, wide, regular, and smaller diameters, and even nowadays we have also what we call mini implants. And mini implants are implants that are less than 3 millimeters in diameter. Those implants, and I find there's a lot of dentists that they talk about them, are mostly suitable for stabilizing dentures, and they're very easy to be put. Most of the time you don't even need to raise a flap, because you just have to assess the bone, and basically we can make just a small indentation in the bone and just screw them by hand into the bone, and then at the same time we can try to put that denture and take an impression and pick it up, and they can have it instantly. So it's a great way to stabilize dentures, and it's very successful as well. So some companies even go further to advertise for them to restore even individual teeth. I still believe that we need an implant a bit wider than that, because when we put an implant, you need to have an anchor that is a little bit strong, and some of them are not really strong enough to withstand replacing a tooth, like a normal crown or something like that. After we assess the patient, it's very important we raise a flap. And a flap meaning is that we make a cut in the gum and then we reflect it very gently. So you can see the jawbone exactly, and that will give you an idea about diameter of the bone in there, and it gives you a vision of what you're doing, and that can help a lot in assessing the position and the diameter of that implant to be put in there, and makes things less problematic as well. A flap is the traditional way of doing dentistry, and especially if we're dealing with a narrow ridge, it is very important that we raise a flap, because sometimes we need to flatten a little bit of the bone to get a little bit more width to put that implant in there. So with the guided surgery, which is great, the use of technologies, basically we take a model of the jawbone of that patient, and then we send it to certain companies that they will provide us with a guide that it has a certain opening to drill through it. But still, I still believe sometimes, no matter whatever you're doing, it will be more preferable to raise a flap and to see what's going on. Having said that, sometimes there are cases that it can be very easily be done with guided surgery when you have a lot of bone. But if you have not a lot of bone, my preference is to raise a flap, and in most of my cases I still believe raising a flap is a better way, because you're seeing things on the spot. And sometimes even with guided surgery you will still need to know how to raise a flap. So raising a flap is, I think, is the key for putting a successful implants in there. But with more and more developments, we will get into a stage where we can do guided technology with more and more diligence and accuracy as well.